Hi, my name is Jennifer Avila and I'm going to talk about bronchial asthma. I did this structure so I can show you guys what part of the body I'm talking about. And on this side, I made the structure 3D. So I'm going to talk about this part first. So we have the nose, mouth, pharynx, lungs, larynx, trachea, bronchi, and bronchioles. So I'm going to talk about these two main structures, and later on I'm going to talk about what I did on the 3D part. So it starts with a cough, a wheeze, feel the chest feels tight, you feel you don't have breath, and these are the symptoms of an asthma attack. Over 300 million people suffers of an asthma attack, and over 250,000 people die of it. So asthma affects the respiratory system, such as an airway, bronchi, and bronchioles. These airways have an inner lining called the mucosa. This is surrounded by a smooth muscle. So this is the smooth muscle, and the inside of the black line is the mucosa. So you guys can see it. In people with asthma, the airways are chronically inflamed, hyperresponse. These are caused by tobacco, pollen, dust, exercise, stress, and a common cold. If an asthmatic is exposed to a trigger, the smooth muscle ring of a muscle contract and become narrow. Mucosal lining more swollen and increased. During an asthma attack, the mucosa blocks the narrow airways, making it even harder to breathe. I can show you guys. So this is a relaxed, smooth muscle, a normal airway. This one. So this is a normal airway when you don't have like an asthma attack. We got the wall inflate and thicker. This one. We can see that it's getting more hard to breathe in this part. If an asthmatic is exposed to a trigger, the smooth ring of muscle contract and become more narrow. This is what we're talking about in these two structures. It's getting harder to breathe. The inflation can make it harder to exhale than inhale. Over time, this leads to an excess of an air in the lungs, a phenomenon known as hyperinflation. This is when inhalers comes in to the rescue. But before that, I can show you guys, this is the smooth muscle comes more tighter. You can tell that this part, it's harder to breathe because the mucosa is working so hard that it's hard to move around. So this is when inhalers' primary treatment comes to the rescue. This medication was asthmatic, both controlled and prevent the asthma symptoms. Inhalers transport medication along the affected airways using a liquid mist or fine powder to treat the problem and its sources. They release beta antagonists. Betas relax constricted muscle to more air can travel to lungs. And on the other side, we have the corticosteroids that reduce airway sensitivity and inflation so asthma can be controlled. So I have this. This is my inhaler that I have. So when people have their airways like looking like this, they just inhale it 2 to 3, depends on what the doctor indicates. So your lungs can look like this. They become normal. So yeah, so we can continue to keep finding a better solution for the asthmatic people, and help solve this disease to help them, make them happy and feel better and reduce the asthmatic attacks. So that's all that I have. Thank you.